Hello, welcome to the Chelan-Douglas County Medical Reserve Corps. Before we get started, I want to say thank you for joining the Medical Reserve Corps. This is part 1 of the orientation course. When you are finished, you will need to listen to part 2 to get full credit for the class. The videos will take you a total of about 25 minutes to complete. In this orientation, we will focus on several topics to help you get acquainted with our Medical Reserve Corps program, or MRC as it is commonly called. First, some background and history of the MRC. We'll talk about activations of the MRC in our region and who can join the MRC. Then we'll go over the role of the MRC in emergencies and non-emergencies. I'll also go through all the training and health screening requirements. Finally, I'll take you through how an activation of the MRC works from start to finish. The Chelan-Douglas MRC was founded in 2023 as a vision generated by Kent Sisson and Luke Davies to establish a group of trained volunteers to respond to our county's growing population and need for local support in emergencies. There are MRC units all over the country, but what you might not know is how the Chelan-Douglas County MRC fits into the larger nationwide program. At the top is the U.S. Department of Health and Human Services. Then there is the Office of the Assistant Secretary for Preparedness and Response, ASPR, then the Office of Emergency Management, OME. The Partner Readiness and Emergency Programs Division, PREP, and the National Medical Reserve Corps Program. Wow, that's a lot of federal agencies, but let's get a little closer to home. The Washington State Department of Health manages the State Emergency Registry of Volunteers in Washington through WASERV. WASERV is the registration and contact system for emergency volunteers. In addition to WASERV, the Chelan-Douglas Health District leads the local MRC unit that you are a part of. We work closely with the state program and national MRC programs. Now let's talk about the roles of MRC volunteers during different types of events. The mission of our MRC is to strengthen public health and response to community emergencies. The MRC can also support local public health initiatives during non-emergencies, such as providing support at first aid stations for community events, providing emergency preparedness education, and promoting health and safety throughout our 2-county area. I'm going to go over the MRC's role in both situations. First, emergency response. MRC's response roles include mass dispensing operations with public health, which I'll talk about more in a few minutes, assisting with shelter operations and any other needed county emergency operations. During non-emergency events, the MRC can be used to enhance preparedness in the community, mitigate health disparities, assist with disease outbreak investigations, and assist with other small-scale emergencies. Examples of this would be staffing healthcare first aid booths at local events such as fun runs, county fairs, and festival events such as Apple Blossom. We understand that there can be many demands on your time in emergencies, and we will never pull you from an existing emergency role that you may have. The MRC can be deployed by public health, or our community partners may request help. We have many response partners throughout the region who could request assistance. These partners include hospitals, clinics, fire, emergency responders, and the Chelan and Douglas counties, which includes cities such as Leavenworth, Kashmir, Wenatchee, Malaga, Rock Island, East Wenatchee, Waterville, and Bridgeport, just to name a few. MRC volunteers can be deployed by Chelan-Douglas Health District or Chelan County Emergency Management Services to assist our community in a variety of ways, such as evacuation assistance, shelter or call center setup, registration, traffic control, first aid stations, cleanup efforts, medical services such as immunization clinics, pandemic response. And we work alongside with other responding agencies during incidents, training and exercises, including the Community Emergency Response Training. We also work with the first responders, the American Red Cross, statewide, and other MRC units. Let's talk about who can join the Chelan-Douglas MRC. This is important because different counties may have different requirements for MRC members. To be eligible to join the Chelan-Douglas Medical Reserve Corps, individuals must be over the age of 18 and have an active phone number. Volunteers can be from non-medical or medical backgrounds. Medical volunteers must have a current unencumbered Washington State Health Professional License, which can be verified through the State of Washington Provider Credentialing website. Many different health professionals can volunteer. The Chelan-Douglas MRC is dedicated to the safety and health of our communities. Please take a moment to scan this list and see if you know people that you think may like to join the MRC too. Our greatest recruitment tool is you, our volunteer. Volunteers must also complete a criminal background check. Criminal background checks are conducted on all volunteer applicants because there is the potential that an MRC volunteer could be in contact with underage children, vulnerable adults, or seniors. For effectiveness and safety, the MRC is based on ICS or Incident Command System, which is a standardized approach to the command, control and coordination of emergency response. FEMA, the Federal Emergency Management Agency, established the National Incident Management System, NIMS, which includes ICS, as the standard for emergency management by all public agencies in the United States, for both planned and emergency events. ICS is all about ensuring the safety while providing the most efficient method for response. The MRC usually falls under the operations section. Sometimes the MRC might work under the PIO if a call center is needed. In emergencies, one of the two most likely volunteer deployments you'll encounter is the point of dispensing or pod. A pod is a fast and standardized way of delivering medications, vaccinations, or even distributing supplies to a large population. A pod is a general blueprint of how to run an operation and has specific procedures that can be scaled to fit any size event. Flu clinics and COVID testing are good examples of pods. The health department offers opportunities for training and exercising in setting up pod operations. Another likely deployment for the MRC is for work in a support call center. When a public health emergency happens, there is always a large volume of calls and questions. When local public health's capacity to respond to those questions is exceeded, we may open a call center. We would use MRC volunteers to staff that call center and provide information to the public. Examples of this is the COVID pandemic, when the support of a call center would have been beneficial. Call services can be invaluable in the event of a large disease outbreak, bioterrorism incident, or other large-scale emergency. To answer questions and relay information efficiently. Now we will move into the training and health screening requirements for MRC volunteers in the Chelan-Douglas Medical Reserve Corps. We will review each requirement now, and you can find a full list of these requirements included in the CDMRC Volunteer Handbook. The first training requirement for any emergency or non-emergency activation of the MRC is to complete this orientation course. You will also need a CDMRC ID badge in order to volunteer for any activation. We can take a photo, or you can supply us with a passport-style photo. A passport-style photo is a clear picture without filters of your face and top of shoulders taken from the front and against a white or very light background. No hats, selfies, or action shots, please. If an emergency happens before you get your badge, you could wear your work ID, but we would like to be sure that all new volunteers get badges as soon as possible following completion of Tier 3 training. We also require HIPAA, Health Insurance Portability and Accountability Act, training to be completed when joining the CDMRC and refresh this training every 12 months. HIPAA is the federal law that restricts access to individuals' private medical information to ensure that everyone has the same understanding of HIPAA. All CDMRC volunteers will be required to attend our Chelan-Douglas HIPAA training even though you may have had training in the past or with another organization. We take our commitment to honor individuals' privacy seriously. And finally, we require verification that you have completed a bloodborne pathogen training within the last 12 months. Our MRC coordinator tracks trainings and will need a copy of the bloodborne pathogen training certification for your records. All volunteers must verify their bloodborne pathogen training every 12 months to be eligible to deploy. We also have a self-health screening form so you can review and verify some health screening requirements. Depending on the nature of the event, you may be asked to verify that you have been vaccinated for or are immune to measles, mumps and rubella, varicella and hepatitis B. You may also be asked to verify that you have had a negative TB skin test in your lifetime. For these health screening requirements, we don't need your lifetime immunization record. In order to be ready ahead of time, you must complete the self-disclosure form. If your immunization status is unknown or you don't have a doctor, We recommend that you go to a local healthcare provider such as Columbia Valley Community Health or Confluence Health Clinic at the Mares building to establish a medical provider. Medical appointments are at your expense and the health district does not offer health screening or reimbursement for these services. Public emergencies can happen very quickly. It's important to be prepared by completing all the requirements now to be able to deploy.
Complete your requirements now. All new volunteers must complete the requirements before they are accepted into our MRC unit and prior to deployment to any emergency.
We also have some trainings that you may be asked to do before deploying for the MRC. The two courses are the IS 100 and IS 700. The IS 100 is the Introduction to Incident Command System, an online course that provides an overview of the system unset nationwide to manage incidents regardless of size or type. The IS 700 is the NIMS, which is the National Incident Management System, which allows organizations to work together seamlessly to prevent, protect against, mitigate, respond to and recover from the effects of incidents. These online trainings are useful for understanding how we organize to respond to emergencies. For more information, simply visit the Chelan-Douglas Health District webpage.